privilege today of talking with a friend of mine who I'm just delighted to have on the set today because I know she's going to bring lots and lots of information about an organization that's been around for quite a while. She's Mary Elizabeth Marr, and she's the CEO of Thrive Alabama, formerly known as the AIDS Action Coalition. Welcome to the broadcast.
Thank you. Thank you so much for having me today.
It's great to see you. And of course, this is a conversation that I've been looking forward to having because every time we get a chance to talk about the organization, there's great things to say. And since 1988, and I'm just sitting back for a moment, just sort of embracing that and absorbing that because I remember the beginning of this process. And in many ways, I was kind of there during the early stages of this process. I can't really say, has it been that long or does it seem like it's been that long? But over the years, almost 30 years of this organization's existence, so many things have happened and we've come such a long way. I want to spend just a moment letting people know about what the agency is, and then I want to kind of take us back a little bit as we move forward to the present circumstances that the agency finds itself in with a rebranding and all kinds of other great stuff in terms of expansion. So tell us, first of all, what is Thrive Alabama, formerly known as the AIDS Action Coalition?
Well, we're a very large organization, nonprofit here in town that actually covers the territory between the Mississippi border to the Tennessee border, Georgia border, all the way down to Birmingham. So we have a wide expanse of territory that we cover. We are the only HIV-specific clinic in North Alabama, but we do much more than HIV, hence the need for us to change our name to Thrive Alabama. So we have a substance abuse program. We have housing for people with disabilities, not just HIV, but any disabilities. We have a very vibrant education program, mental health counseling, translation, transportation services, and we are getting ready to open our 4th clinic.
Wow. And you, of course, have been involved with this agency for so long. I just want to kind of go back for a moment to 1988, right in the thick of the AIDS crisis, just as America was really waking up to the fact that this epidemic was real and that it was beginning to really kill people. A lot of people know my story. I lost my sister to AIDS in 1988. And so from the very outset of this organization, I had a keen interest in what was going on at the local level, even though she was in New York. And I was also interested in what was happening at the national level as well. And I want to just take our audience back for a moment because I remember the dark days when this agency was starting, but also funding was short, stigma was rampant, and all kinds of other challenges existed in what seemed like at one time a kind of a hopeless environment. What are your recollections of that time?
Well, in some ways, I'd like to say we've come a million miles, and then in other ways, we are still in the thick of things. So in 1988, there were no drugs. So when your sister was infected, really there was no hope for what could happen. Those who stuck around long enough for AZT to come about, that was the early 90s, and then mid-90s we started off with the cocktail of drugs where they would put drugs together and hit the virus in different ways, to where today we have a drug called Truvada, which is an AIDS drug that people who are highly at risk for HIV infection can take and they will not get HIV. That's one of the new things that we're doing is that we have the 2nd PrEP clinic. It's called pre-exposure prophylaxis, and someone can actually take a pill once a day and not come in contact with HIV or not get infected with HIV.
And then you also have what I would call, for lack of a better word at this moment, the curse of the evolution of the development of medications, because with the cocktail availability with drugs like Truvada, a lot of people in 2016 kind of walk around with a sense of invincibility and continue to make choices that really put them at risk because they kind of back away from the process and think that everything is okay now. But that's not the case.
People do think that. They think, oh, there's a drug. Young people think, oh, there's a drug, I can take a pill. But they don't think of all the ramifications of actually what happens to their body, and the fact of taking a drug for the rest of your life.
Yeah.
That really, there's an economic situation with that, but as well as just trying to figure out how to deal with having a chronic illness. And that's what we call HIV/AIDS today, is really a chronic illness, but one that still does not have a cure, and that we don't want people to get in the first place.
And in 2016, this is still a 100% preventable disease.
Absolutely. Absolutely. People can use condoms correctly and consistently. They can now take the drug Truvada, and they will not get HIV, which we liken Truvada to birth control of the 1960s. I mean, there's that same idiosyncrasies around taking the drug that, well, it makes people just, be out there. Well, that's kind of what women faced when in the 1960s taking a birth control pill. So it is, the evolution of taking care of this virus is amazing, but we still don't have a cure, and the stigma is still so prevalent.
So we're in the Bible Belt, and this is something that we've talked about for almost 30 years now.
Almost.
We're right smack in the Bible Belt, but yet some of the highest rates of infection, some of the highest at-risk behaviors that people engage in right here in this state. Talk about the problem of HIV/AIDS in Alabama today.
Well, we have about 15,000 people living with the virus, which doesn't sound like a lot of people, but that's more than 1% of the population nationally living with the virus. In the South, there are 9 Deep South states that we consider the hotbed of HIV infection, and we are right in the middle of it. These 9 states have 51% of all the new infections in the whole country.
Wow.
So when you think about HIV infection, people think of San Francisco and Washington, D.C. and New York and Los Angeles, but really the South is where this is all really coming to situation. Part of that reason is because we have problems with lack of access to good medical care in the South. I mean, this is not just for HIV, but for all diseases. We have a lack of education because we are in the Bible Belt, so people don't want to talk about prevention, don't want to talk, everybody wants to talk about abstinence when we need to talk about comprehensive sex education in our schools for our young people. It's a much bigger problem than just HIV, and we do have socioeconomic issues in the South.
Yeah, and all of those things, of course, have to be factored into any kind of programs or processes that you initiate.
We need Medicaid expansion in the southern states, which is still very slow to coming about. When you have a whole community of people who are not getting good access to medical care, that causes a lot of problems, not just HIV.
Yeah, and of course, I know traditionally you've had your battles where you've been fighting for access to medical care, fighting for access to ears that will listen. There have been initiatives in the faith community.
Absolutely.
That have been launched, and I know you've been involved with some of those.
I have.
Talk about that, because that's a group that's hard to cut into sometimes.
It is very hard to cut into, but Laura Hall has been the forward thinker in the African American community, not only down in Montgomery, but she has a group that she started years ago called the Community Faith Gathering. You and I go to their breakfast once a year, but they do initiatives throughout the year. They work with 100 Black men, also with 100 Black women here in Huntsville. We work with churches, we go to health fairs, we've been working on navigating and helping people get affordable health care through the ACA. So there's a lot of little places that we have been very involved over the years.
Do you still take the perspective that knowing your status is probably the best place to start for everyone?
For everyone. Everyone should know what their status is, and that goes to kind of a segue into one of our newest initiatives. On December the 1st, we opened an STD clinic in our 600 St. Clair group of a complex of little buildings. And the reason that we did that was that the health department is woefully underfunded and understaffed, and they just were not being able to keep up with the need for not just testing for STDs, but treatment. So we did hire, we have an STD clinic. It's called the Wellness Clinic, and we have hired a very well-trained nurse practitioner, so she can do not just testing but treatment of all kinds of STDs. We were having people come to us and say, we'd like you to test us for HIV, which we've done since 1988, but we'd like you to test us for everything. And we, up until this point, had to turn people away. So we can test for GC, for syphilis, for trick, for all the different HIV and HIV genital warts, and we can do the treatment for those. We do ask for, if someone has insurance capability, we do charge your insurance and do charge a copay, and a very small fee if you have no insurance of $15 copay.
Yeah. So we have just a few minutes left in the broadcast today, but I did want to ask you this so that people can perhaps take action and not only find out more about your organization, but let's say, for instance, that there are people out there that are wondering about their status today or tonight, whenever you're looking at the program. What's the quickest way to get tested? What are some options that people have?
We have a 20-minute test, a rapid test, which will give you either a totally negative response if there is a small window period. So if you've been recently infected within the last couple of weeks, we'd ask you to come back and get another test done. But within 20 minutes, we can tell you whether you're reactive. If you are reactive, we need to do a follow-on test. So we're open from 8 to 5, closed from 12 to 1 for lunch at 600 St. Clair, Building 7, Suite 18. And then on Fridays, we're open from 8 until 12.
And those over-the-counter opportunities that people have are available as well. I know they've gotten a little bit better over time.
They have. They're a little pricey, but if you do want to take a home test, you're able to do that. Some people take a home test and then come back and want to see if they've come in contact with any of the other STDs that kind of can go hand in hand with HIV.
Right. Well, you have all these great services right here in this community. People don't have to walk around worrying or live in isolation. You have great support mechanisms as well. How can people get more information about your services?
Come to our website, www.thrivealabama.org. You can also visit the website, but you can even visit our organization. We, as you said, we have lots of support. We have support groups. We have AA meetings. We have NA meeting. Substance abuse treatment, housing, all kinds of things that people can, really take advantage of if they're eligible and if the problem is their problem.
And you have a great board and staff as well that actually anchor this whole process and make all these other wonderful services so successful.
And we also offer translation services, so we have several bilingual staff who can help our clients who have a translation need.
Mary Elizabeth Marr, she's CEO of Thrive Alabama, formerly known as the AIDS Action Coalition. Thank you for visiting with us today. And I know you have so much more to say, so come back and see us sometime.
Thank you very much for having me today.
All right, thank you. I want to thank you for being a part of our conversation as well, and we hope that you'll tune in from week to week to this broadcast Impact. We also hope that you will like our Facebook page at Impact with Kenny Anderson, so that you can keep up to date with the great information that we're sharing on a regular basis. In the meantime, I hope that you have a great rest of the day, and we'll talk to you again soon.